LASIK is always something that we're very interested in doing because it helps a patient to get out of their contacts and glasses. And the way it works is we change the shape of your cornea using laser technology to get rid of your prescription. The way LASIK works is we use a laser to create a flap, and then we lift up that flap, and then we do a second laser to change the shape of your cornea, and then we put the flap back down. The nice thing about LASIK is you have that kind of wow factor, that instantaneous, you're done and you can notice a big difference in your vision. LASIK is constantly changing. We always like to, prior we used a blade to create your flap, and now we use a laser, and even that laser is upgrading just the shape of the flap we use to make it less chance of having a dislocation or any problem with the flap. And then we're also changing the second laser that we use in terms of how it changes the shape of your cornea, constantly figuring out what's going to be the best pattern to use and just to get the best vision possible. We always like to make sure that patients are good candidates, because there are some patients that are not good candidate depending upon the health of their eye, the shape of their eye, and their prescription. The good thing is that the majority of patients are good candidates, and we'll be able to tell them if you are if you come in for a surgical evaluation. So most patients are candidates for LASIK, even if you're farsighted, nearsighted, or have astigmatism. A lot of people think that if you have astigmatism, that's not corrected during LASIK, but it always is. And so you just come in and we make sure you're within that range. And if you're out of range, there are other surgeries we can talk to you about. And also if you need reading glasses, there's a lot of options that we can talk to you about as well. LASIK surgery can be customized in the sense that you may have a prescription that's very similar to your friends, like you're both a -2, but you have higher order aberrations, which is just a way that the light comes into your eye that's different from your friends. And so we use wavefront technology as a way to analyze those higher order aberrations, and that way we can correct that during your LASIK. So we're not just correcting the numbers that are in your glasses or contacts, we're correcting those higher order aberrations or those better errors. And the benefit of that is we can give you less glare and halos and give you that kind of high definition vision. We do our surgery at the Kaplan Surgery Center, which is only about 10 or 11 miles from the Pearland office. And you'll arrive there and check in, and once it's your turn, you'll be brought to the back and you'll get prepared for surgery, which includes getting an IV, and your eye will be dilated, and we'll have nurses that are dedicated just to you to prepare you and make sure you're comfortable during your surgery. And then once you get into surgery, we'll get you comfortable and make sure you have enough sedation and feel comfortable during your surgery. And then we perform surgery, which only takes less than 15 minutes usually. And then afterwards, you will be observed for a little bit, and you'll go over instructions with you and your responsible party, and then you'll go home. You'll only have to go to the surgery center for your surgery, but all of the other care will be done at the Pearland office. LASIK is a procedure where some people are nervous just because they don't know what to expect. The nice thing is that you are awake and you are comfortable during your surgery. We give you a little bit of sedation beforehand to kind of take the edge off things. We kind of want you awake just because you need to look at the laser and be a little bit cooperative. But we walk you through it. We give you hands to hold if you need it. We talk you through it, and we give you breaks if you need it. But most patients are very, very comfortable and would be recommending it to their friends because it's not as bad as they think it is. Most patients will notice a big difference immediately after surgery. It'll still be blurry, kind of like you're looking underwater, but they'll notice a big difference in terms of what they could see with their LASIK as opposed to what they're without glasses or contacts. And then the next day they'll notice even better difference. We like our patients to be driven the next day just because there could be some flap dislocation or wrinkling, and we need to go back in and do a little procedure to fix that. So we want to make sure someone's with you the next day. But after your post-op appointment, if things look good, you can drive and go back to most of your normal activities. Within our practice, we have 6 LASIK centers, and those are only dedicated to LASIK. We don't do anything but LASIK patients there. So if you're having any refractive procedure, you'll be cared for by someone who is very familiar with LASIK and LASIK patients. And they're scattered throughout Houston, so if anywhere you need to be, or if you have a friend that needs LASIK surgery, we can find a place close to them.